Beyond Clean continues to provide content and updates related to the COVID-19 pandemic, and specifically here in the United States as we're being hit right now with the initial wave. And joining us today is Buffy Lloyd-Krejci, Infection Control Specialist and CEO of IPC Well. And Buffy, I'm really excited to have you on because we met on a plane, I want to say almost a year ago, and we've been corresponding ever since. You're on your way to a conference. It was a great connection for the both of us to make, but now I think the timing is great for you to come on. Maybe a shorter version of the podcast, but share your insights as an infection control specialist. Thanks for coming on.
You bet. Thanks for having me.
One of the things we talked about in leading up to this interview was passing the message that's being spread by the World Health Organization about 5 steps to kicking out coronavirus. Can you summarize that and why that resonates so directly with you as where we need to be placing our focus?
So I listened to the 3 times a week WHO media briefs that they have. And this past Monday, the 23rd of March, they were describing how we as not only a country, but as a global population have to start taking an offensive, not just defensive approach to mitigating this virus. And what that entails is a comprehensive approach for public health measures, physical distancing, government strong approach, mobilizing populations, and that every single individual needs to know what they can do to fight this pandemic. And what that really means is that we need to be aggressive. We need to fight this infection. We are starting to do great with social distancing, but we need to be on the offensive. So we need to do high aggressive case findings. Every single person that is symptomatic needs to have a test. We need to do contact tracing so that we identify whoever is tested positive, then we see who they came into contact with, and then those people can be isolated and quarantined. We need to do community surveillance, and we need to be able to test anybody that has been in contact with anybody that's been sick. So it's important that we are social distancing, but it's only buying us time. It really is just helping public health to kind of scale up to be able to handle the cases within their healthcare system. But it's it's like maybe a Band-Aid. We need to do more.
I love that we're talking about being proactive. A lot of this situation for many people out there feels like we're in a reactive position, trying to get the supplies, stock our homes with food. We've seen everybody go and raid the grocery stores, and then there's not enough supplies for everybody else who needs them, including groceries. I think one of the things that people have been doing to sort of stay stocked up and keep things going is utilizing a service like Amazon. And as of the day that we're recording this, Amazon announced that there were at least, I think, 8 different shipping centers where workers there had tested positive for COVID-19. So just to help people be directed correctly and staying on focus, like we were just talking about with the World Health Organization's recommendations, what should people at home be worried about relative to Amazon and its shipping goods? I think a lot of people are talking about how long does the virus live on cardboard, for instance?
Well, based on the WHO and the Centers for Disease Control and Prevention, this pandemic is not being driven by the virus living on environmental surfaces. It is a factor. There are fomites that do live on the environmental surfaces, and that's why it's important to clean and disinfect and also wash our hands so that if we happen to touch a surface, then we don't want to then touch our mouth, potentially spread the virus. However, it's not the driver of the pandemic. Most people, according to, like I said, our national and global authorities, are contracting this virus by being around symptomatic sick people. So the social distancing measures are really important right now to implement, and this is why we're seeing potentially what's occurring in Amazon with the different 8 centers that had a lot of sick people, is perhaps the social distancing practice weren't being implemented, or if people were sick, that could be the case for it as well, but not necessarily just with it being on the environment. So I think we need to not get too caught into the weeds. The reality and the best thing people can do, and this is from the WHO, to number 1, we need to wash our hands, implement frequent hand washing because the virus can be transferred to our mouth, our nose, our eyes, so we want to make sure we're washing our hands. Number 2 is our elbows. We want to bend our arm and our elbow, and we want to cough into our elbow so that we're preventing the spread of anything coming out of our mouth or nose. The third one is face. Avoid touching your face. I tell people personally, and I catch myself with this, I'm a face toucher. I know it, and this has been a good time for me to practice to stop touching my face. The fourth one is distance. Take a step back. Stay 6 feet away from people as much as you can, especially if you see somebody sneezing or coughing. And the fifth one is feel. If you feel that you are coming down with something or feeling sick, stay away from other people. And those are really the 5 main things people should be focused on, and that helps them then protect other people in their communities.
Thanks for just reminding everybody where the core areas of focus should be, and for coming on this brief update from Beyond Clean on the COVID-19 pandemic. Have a great day, and thank you for joining us again.
Thank you so much for having me.